I now have the great pleasure to invite one of my board members, Dr. Ben Miller, a psychologist who's well known in the the mental health space, now the maternal mental health space as well, to the main stage, along with our two awardees. We started 2 years ago with creating an award to honor and publicly recognize leaders in maternal mental health. The award has gone to the founder of the Child Psychiatry Consultation Program, which later became the foundation for the maternal psychiatric access programs that we all have heard much about and are appreciative of. And also last year to the CDC Division of Reproductive Health for their unwavering focus on supporting states in documenting maternal mortality, including maternal suicides. This year, we are honoring two more pioneers for their work in addressing postpartum psychosis. Postpartum psychosis affects roughly 1 in 1,000 mothers and is the most severe maternal mental health condition with symptoms of delusions, hallucinations, extreme confusion, and paranoia. Psychosis is like living in a dream. It could be good or bad and not being able to wake up. Because women experience a break in reality, the risk of harming themselves or their children is a significant concern. And I have goosebumps. Though our awardees have been working for years, researching postpartum psychosis and raising awareness, 2023 brought postpartum psychosis into the spotlight. Most notably when Lindsay Clancy, a labor and delivery nurse in Massachusetts, who was thought to be suffering from postpartum psychosis, took her baby's lives and then attempted to take her own. As a nurse, founder of Postpartum Psychosis Awareness Day, and a mother with her own experience with postpartum psychosis, Christina Delaney, one of our honorees, was one of the experts who was called upon to respond to that tragedy. She appeared on television programs like Dr. Phil and also made opening remarks at the launch of the new Federal Maternal Mental Health Task Force, which we'll be hearing from later. She's also been instrumental in supporting local work in her home state of Tennessee through championing development of work in the public health department and also through formation of a task force in the state to address maternal mental health. Christina, it's my true honor to recognize you as one of our two 2024 maternal mental health heroes. Christina, I open the floor to you and invite you to say a few words.
Thank you so much, Joy. It's with deep pleasure that I accept this award, and I am just so grateful to be here. Sorry, I'm emotional. It's an emotional topic for me, and I'll just let you know that I'll be reading from a prepared speech because of the gravity and importance of this time and my nerves as well. But I am so grateful that this space exists, and I'm deeply humbled for this honor. Last year was a really big year for perinatal psychosis and awareness, but as usually, that was largely due to tragedies that occurred. And as you might imagine, doing this advocacy is regularly time-consuming and emotionally challenging. And while tragedies give us the opportunity for greater awareness, they are typically very triggering for survivors as well. So we work at double pace while trying to manage our own difficult emotions. We keenly feel the loss and terror with the visceral knowledge that could have been me, or it could have been my family. Sorry. We feel that whether it is an incident that makes a big media splash, or if it is much more common tragedy that doesn't even make a blip on the national news, and we know that these tragedies are only the tip of the iceberg of trauma and loss caused by this illness. Senseless trauma and loss that can be largely prevented. So we seize the opportunity to raise awareness when we can, and even when we know that such outsized attention on such a tragedy further stigmatizes this illness by reinforcing the link between it and infanticide. It can feel to us as advocates as if it is difficult to get people to pay attention, to look at this illness, except when something so shocking occurs that they cannot look away. I keep saying we and us because although I stand here by myself alone, I'm not alone because there are so many other advocates that are so passionate about this work and those with lived experience who pour their hearts into this, and each of us matters. I never expected to be such a public face of perinatal psychosis and do not take that responsibility lightly. There's still so much to learn and understand for both professionals and advocates, and we need to learn from each other. It's imperative that professionals include persons with lived experience of perinatal psychosis when educating or presenting on this topic. Survivor stories are important, and additionally, survivor advocates have valuable knowledge and unique perspective through the synergy of advocacy and lived experience. The disability community uses a slogan, "Nothing about us without us," to claim the right to having representation at every table in every situation that pertains to them. And I'd like to claim that for perinatal psychosis too. Last year, I heard a very knowledgeable person speak of the importance of calling people in instead of calling people out. So I'm calling you in, calling you to the opportunity to include those with lived experience in those spaces you occupy that impact decisions, those spaces of influence and change. I think you may be surprised what we can offer. Every survivor has a story. And every advocate has a why. My why started with my own girls and their future, but it has grown exponentially through my experience as an advocate. I don't know where my advocacy journey will lead me, but I'm grateful it has led me here, and I'm grateful to be alive. And I'm grateful for this opportunity to speak with you and for your kind attention. Thank you so much.
Thank you, Christina, for your story and your wisdom and your advocacy. I now would like to turn it over to Dr. Ben Miller, who's going to be recognizing our next honoree, Dr. Cohen. Ben, I'll turn it over to you.
Thanks, Joy, and congratulations, Christina. So it's my honor to get to present today's second awardee, Dr. Cohen, who's a psychiatrist who's dedicated to enhancing women's mental health. As the director of the Ammon Pinizzato Center for Women's Mental Health at Mass General Hospital and the Edmund and Carol Carpenter Professor of Psychiatry at Harvard Medical School, Dr. Cohen is a true leader in his field. His commitment to women's health and his own professional journey in psychiatry really began with his residency and training at Mass General, where he honed his expertise in this space. It's safe to say that Dr. Cohen isn't just a leader in the field, he's a trailblazer, someone who finds new paths to go down where there are none. He creates them. When you look at his impressive background, so much of it spans research, teaching, and clinical care, with the real focus on mood and anxiety disorders, particularly those associated with women. From psychiatric disorders during pregnancy and the postpartum period to depression in women midlife, and the intersection of infertility and mental health, Dr. Cohen's expertise really does run the continuum of need. In fact, as an academic, I got to geek out a little bit and looked at a lot of papers recently. And Dr. Cohen, there was a recent paper that you published in the Archives of Women's Health, and you examined the barriers to care and why women who needed treatment for postpartum psychosis didn't get it. And those who did get it, what did they think about it? This analysis, part of the Mass General Hospital Postpartum Psychosis Project, really gets into the why his work is so important. Based on insights from the participants, he highlighted how it's clear that accessing care for postpartum psychosis is tough due to a lack of available services. Most haven't had prior need to see a psychiatrist, so when they do need help and help may not be there, they turn to obstetric providers or emergency rooms for help. But even then, they often feel like they're not getting enough information to handle their condition. Hospitalization in general psychiatric hospitals is all too common, but it means being separated from their babies and struggling to breastfeed without proper support. These findings scream out the need for better access to specialty care and stronger support networks to give folks dealing with postpartum psychosis the help that they desperately need, which is what Dr. Cohen has been advocating for. So Dr. Cohen is not just a leader in this space, he's an inspiration to many of us that are looking to see where we're going as a field. As I mentioned, as a fellow academician, it's wonderful to see how his contributions aren't just confined to the ivory tower. They extend into the trenches of clinical care. Whether it's through therapy, medication management, or unwavering support, Dr. Cohen is really helping countless women. But Dr. Cohen's impact also goes beyond the clinic walls. Through his research and teaching, he's empowering the next generation of healthcare professionals to better understand and address women's mental health issues. His work isn't just about informing care, it's transforming it, paving the way for more effective treatments and better outcomes. So it's no surprise that today we're celebrating you, Dr. Cohen, and honoring you with this award for outstanding contributions to women's mental health, and most specifically for leading the way towards improving postpartum psychosis care. From my reading of your work, this, like I said, it's not just a career. This seems to be a calling for you, a testament to your unwavering commitment to improving the lives of women everywhere. So congratulations, Dr. Cohen. I'll turn it over to you for a few brief comments.
Sure. First of all, Dr. Miller, thank you so much for that. That's just incredibly kind introduction, and I'm heartened and I'm humbled. The work that I've been doing and that we've been doing at the Mass General Center for Women's Mental Health now for 30 years really has been founded in the wish to partner with, frankly, advocates like Christina Delaney. And I think it's because of that partnership with people whose heart is in advocacy that's allowed us to really go from clinical care to research and to hopefully answers from that research that inform how we treat patients. I hear when it comes to postpartum psychosis, for years I've read that postpartum psychosis is rare. It's rare unless it's your sister or your niece. And then it's suddenly not so rare, and it can be very close to home. And I became increasingly interested in postpartum psychosis, frankly, several years ago, when I was so humbled and pleased to take an invitation to speak at one of the postpartum support international meetings, and then go to a lunch with postpartum psychosis survivors, those with lived experience. And I decided that we were going to go and establish a specific project, the Postpartum Psychosis Project, which is a way of collecting very good data on postpartum psychosis, everything from descriptive data to data in neuroimaging, to see if we could better understand the illness at the level of the brain, and also through the stories that women share about their lived experience. So basically mixed methods with both a very scientific and translational approaches to also looking at the language that women use to describe their experience. And what I've really learned, and what I would share with people as I think about my career in maternal mental health and then our interest in postpartum psychosis, is, what I've learned is that we have a long way to go as far as we've come already, but we have a long way to go in terms of destigmatizing both postpartum psychiatric illness and particularly postpartum psychosis. And we have a long way to go, but I'm optimistic about our ability to destigmatize postpartum psychosis and to enhance treatments and to teach our colleagues. You mentioned mghp3.org, which is the URL for the Postpartum Psychosis Project. It was our interest in making available our faculty with expertise who could be available to colleagues across the country if they had questions about postpartum psychosis as part of our work. But I think that the take home for whether you're an advocate, whether you're a resident in whatever specialty, or you're a psychiatrist or even a subspecialist, is that what I've learned is that postpartum psychosis is an exquisitely treatable illness. And that we can get patients well after suffering from an episode. I think, as Christina just so elegantly describes, it is a experience, as we talk to patients, that rock the families and communities and patients themselves. But I think that I'm optimistic, even after 30 years of practicing perinatal psychiatry, that we're going to move forward and minimize and continue to mitigate the toll of untreated or incompletely treated maternal psychiatric illness, including postpartum psychosis. So again, thank you so much for this incredible honor. Really very, very grateful.
Thank you both. And could I ask that you each hold up your award if you have them with you, so everyone can see them? Oh gosh, it doesn't work so well, does it? There we go. Well, congratulations again. I think about the 250 of us that are here live and those watching the recording are so incredibly grateful for your pioneering work. Ben, thank you for joining me here on the main stage. We do also want to just take one moment of silence to recognize the lives lost to postpartum psychosis and all of the maternal mental health disorders. And I invite you to close your eyes if you wish, and just take a moment to reflect and acknowledge the lives lost. Okay, congratulations again to the two of you. And we honor all of the families touched by postpartum psychosis.